Mediastinum is the middle space in the thoracic cavity between the lungs. The most important content is the heart enclosed within the pericardium in the middle part of the inferior mediastinum or in the middle mediastinum. Above it lies the superior mediastinum. Anterior and posterior to the heart are the anterior mediastinum and the posterior mediastinum respectively. The mediastinum is a medial septum of the thorax between the two lungs. It includes the mediastinal pleura. Superior and the inferior mediastina, the boundaries are: anteriorly we have the sternum, posteriorly the vertebral column, superiorly the thoracic inlet, and inferiorly the diaphragm. On each side, it is limited by the mediastinal pleura. For descriptive purposes, the mediastinum is divided into the upper and the inferior mediastinum. The inferior mediastinum is further divided into an anterior, middle, and the posterior mediastinum. The superior mediastinum is separated from the inferior by an imaginary plane passing through the sternal angle anteriorly and the lower border of the fourth thoracic vertebra posteriorly. Now, the inferior mediastinum is subdivided into three parts by the pericardium. The area in front of the pericardium is the anterior mediastinum. The area behind the pericardium is the posterior mediastinum. The pericardium and its contents form the middle mediastinum. Superior mediastinum. Anteriorly, we have the manubrium sterni. Posteriorly, we have the upper four thoracic vertebrae, that is T1 to T4. Superiorly, we have the plane of the thoracic inlet, and inferiorly, there is an imaginary plane passing through the sternal angle in front and the lower border of the body of T4 vertebra behind. And on each side, we have the mediastinal pleura. Contents: the trachea and the esophagus, muscles, right. So content of the superior mediastinum, we have the trachea in the esophagus. The muscles are the sternohyoid, the sternothyroid, and the lower ends of the longus colli. Amongst the arteries, you can see we have the arch of aorta, the brachiocephalic artery, the left subclavian artery over here, left common carotid, and then the brachiocephalic artery. Veins: the right and the left brachiocephalic vein, upper half of the superior vena cava, and the left superior intercostal vein. Nerves: we have the vagi, the phrenic nerves, cardiac nerves of both sides, and the left recurrent laryngeal nerve. Also, we have the thymus gland, thoracic duct, lymph nodes, the paratracheal, brachiocephalic, and the tracheobronchial lymph nodes. Inferior mediastinum. The inferior mediastinum is divided into an anterior, middle, and the posterior mediastina. The anterior mediastinum is a narrow space in front of the pericardium, overlapped by a thin anterior border of both the lungs. It is continuous through the superior mediastinum with the pretracheal space of the neck. Contains areolar tissue and part of the thymus gland. Boundaries: anteriorly, it has the body of the sternum. Posteriorly, it has the pericardium. Superiorly, an imaginary line separating the superior mediastinum from the inferior mediastina. Inferiorly, we have the superior surface of the diaphragm, and on each side we have the mediastinal pleura. Contents: sternopericardial ligaments, okay, lymph nodes and lymphatics, small mediastinal branches of the internal thoracic artery, and the lowest part of the thymus gland along with the areolar tissue.